Dr. Sachin Jain, thanks for joining me at Digital Healthcare Podcast.
Thanks for having me. It's great to be here.
Is this the first time you've recorded inside a glass case
in the
middle of a conference?
Definitely the first time I've recorded inside of a glass case inside of a conference.
It's new for me too. So
I feel like I'm a caged animal here.
Yeah, right.
So.
At least there's nobody watching us yet, so
we'll try to.
Yeah, right. We'll try to avoid the limelight as best we can. So I want to get right into it. You're president of CareMore. One of the things I read online is that you espouse a very different vision of consumerism. So just put some words around that. What does that mean?
Yeah, so, consumerism is not a new concept in our industry. At this point, it's been discussed for more than 2 decades. And I would say the way most people conceive of consumerism is we want to turn people into shoppers in the way that they are in other industries. We want to give them prices, we want to give them menus, and we want them to choose what they need. And the reality is that's very inconsistent with what most of us actually need when we need healthcare. What we really need when we need healthcare is for things to just work, for the right things to just happen. And I believe it's the responsibility of organizations like CareMore and literally almost every other organization that's represented here at this conference to actually make the right thing just happen for patients. And oftentimes, having a choice is actually almost inhumane for people.
Yeah, and especially no one plans to get sick, right? And so when you do get sick, to your point, you want it to just work and have all the pieces fall into place. And I would say now that's almost the opposite of what happens in a lot of cases.
You got it. And I think so many people ultimately are talking about the appification of healthcare and delivering information about point of service prices. Wrong answer. What we need to do is actually de-stress the experience, not have people kind of running around like, it's Christmas holiday shopping, and actually just have the right thing happen.
Sure. So how would you communicate where CareMore fits into the equation? Because I think one of my takeaways being here is you see all the different companies, and there's some new companies that we probably wouldn't have seen 5 years ago. And I think at a macro level, things are evolving. So how does CareMore fit into the equation there?
Not to be disparaging of any of the other companies here, but we do real stuff. Meaning we have 200,000 patients who get their healthcare from CareMore and Aspire, which is our sister company that we merged with earlier this year. On any given day, we have 1,200 home visits happening where we're delivering primary care or palliative care in a home-based setting for the patients who need it most. So the differentiation is we're actually living in the last mile as opposed to trying to influence the last mile, which is what so many of the folks here are trying to do.
Yeah, and that's been my number one takeaway from the conference so far is that the technology's ready, the products are ready, but they can't figure out how to fit into the equation. And I think that's where you come in, and you probably have such a great perspective to share because so many folks design outside of the system and then try to work its way in.
Yeah, I mean, you need both types of people to make it all work. And CareMore is not a new kid on the block. We're a 25-year-old organization. We were one of the first risk-based medical care companies that had a differentiated model for focusing on high-cost, high-need seniors. It seems like lots of companies are now getting into that space. Many folks think of it as a new idea, but it's actually a relatively old idea. Our founder thought about it in 1993. But it creates this incredible opportunity for us to learn from all of the past mistakes that we've made. And I think that's what I think is really differentiating about us. There's a lot of wisdom contained within the team at CareMore, within the walls of CareMore, within the stories at CareMore that inform how we actually approach things. And so we're able to, I think, create a lot of impact very quickly.
As a leader of that organization, do you is it a point of emphasis to make sure you're hearing the customers that you're interacting with?
Absolutely. So we have public policy boards where we have patient members, it's entirely populated by patients, who give us feedback about what we do. We actually have teams of people who actually meet with patients on a regular basis to get their feedback, to get their input. And what I'll tell you is many of our most significant programmatic innovations in the last couple of years have come from actually listening to patients. We were the first Medicare Advantage entity in the country to actually partner with a ride-sharing company. We partnered with Lyft initially. Right now we're partnered with Uber to actually provide patients with non-emergency medical transportation through ride-sharing. And that was an insight that came from the fact that we realized that existing vendors for non-emergency medical transportation were taking too long. And so, our team said, let's figure out how to fix this, and partnered with Lyft. And now it's a huge business for them, as well as for Uber. And I think it's a great example of where listening to the patient translates into changes in patient care. The other big example is our integrated dental and medical clinic. We realized that the dental experience was so terrible for many of our Medicare beneficiaries that we wanted to try to streamline it and actually integrate it and take advantage of the dental encounters as an opportunity to actually improve patient health. So it's just a really exciting organization. I'm so lucky and honored to lead it.
And when you talk to those patients, I mean, just hearing the Lyft and Uber example, innovation a lot of times happens where you least expect it. Like, I bet if you would have put just your team together and tried to figure that out, it would be really hard to get to the place where you understand the exact needs and difficulties of the patient.
You got it. I mean, we don't even use the word innovation at CareMore.
Really?
We use the term radical common sense.
Okay.
Because we live in an industry that is so bereft of common sense oftentimes. And our business model, being a fully at-risk provider organization, actually enables us to do things that are common sense. Early in our history, we had doctors building ramps for patients who had a high fall risk. We had doctors who provided air conditioners to patients if they got dehydrated and admitted to the hospital in the summer month. It's way cheaper to provide an air conditioner to a patient than to pay for a hospitalization. So it's that type of, another example is refrigerator for a patient who didn't have refrigerator to store insulin. So it's those types of things that we just pride ourselves on.
Yeah.
It's not innovation, it's radical common sense.
Yeah, and especially when you have buzzword bingo with AI and everything, basically every buzzword you hear, I mean, a lot of times you don't need to jump to that place, just start with the basics.
It's hard to sit through a presentation at this conference sometimes when, it really is so rich in buzzword bingo. And, I get it. You need something for people to hold on to. But I think one of the things we've done is we've obscured what's most important. What's most important is the healing touch for the patients we serve, being human. And we need to be more kind to each other as people who work within this industry. I think we also need to be more kind to our patients. And, so it's words like kindness, humanity, humility that I think really need to shape our approach, less than blockchain, AI, digital. And I think you need both. So, the reality is you need both. And so it's, this combination of humanism and digitization that I think is really going to lead us to where we need to go.
Yeah. You mentioned a lot of your competitors or fellows in the industry are following your model. Would you also say, it seems like listening to the user, taking a user-centered approach has been a part of the company pretty much since its inception?
Since its founding, yeah.
And it seems like more companies are going that route. Would you agree with that?
Hard to say.
Yeah.
I think that a lot of companies, particularly early stage companies, have a lot of pressures on them, pressures that are shaped by, the need to commercialize quickly, the need to liquidate quickly. So I see when I look across the landscape is a lot of corners being cut where we should be a little bit more thorough about actually engaging the voice of the patient. One of the things that frustrates me most is how many healthcare founders kind of look at their own experiences as their Rosetta Stone for what to actually do. So, you'll always hear a pitch and they'll say, well, my mother or my uncle or my cousin. And the truth is, if you're in a position to found a healthcare company, you're not poor, you're not impoverished, you're not vulnerable, you're not a senior most of the time. And so, as a result, there's a lot of people's needs being left out of the ideation phase of how, our industry is actually thinking about entrepreneurship and building new companies.
Yeah, that's interesting. I've heard a couple presentations this week where it's like what the entry point to innovation was just talking to the customer, and it just seems so weird that it's taken however many years to get to that point. I can't seem to figure it out. Why? And you talk about just common sense. Why do you think it is that we miss the ball as healthcare companies so often in just the basics?
Yeah, I think the fragmentation is obviously a part of it.
Mm-hmm.
I think you have one group of people who pay for healthcare, another group of people who administer those payments. another group of people who deliver the healthcare, and then within each of those there's like lots of silos. And so end-to-end thinking is just so rare in our industry. And what I'd like to see more of is more integrated thinking. And to do that, you need to integrate payments more, you need to integrate organizations more. And we just don't have that kind of sensibility. I also think, our standards are really low, to be very honest with you. Like what we put up with in this industry is amazing. We put up with faxes. We put up with bills that don't actually make any sense or don't actually explain what's really being paid for or not being paid for. I think we need to kind of raise the bar in terms of what we do and stop calling what we, kind of this run the business stuff innovation and force ourselves to turn the page. I think new entrants are kind of like leading the way in terms of kind of getting rid of some of that legacy stuff. But I think there's lots more opportunities.
Sure. And where you sit and as a company, do you find there's so much room for innovation? I say that just at a highest level. Do you find when you're talking about what to focus on or figuring out what to focus on, what problems to solve, is that part of the problem that there's so much opportunity that you have to prioritize?
There are unbelievable numbers of problems to solve. And I think one of the traps entrepreneurs fall into is they think that their problem is the most important problem. And so, and there's versions of this in the medical profession kind of across training and how we practice, which is we all have kind of our biases about what the most important thing is. And the truth is that it changes. It changes for people, it changes for populations, it changes for organizations. I think, we need to take a disease-based approach, a cost-based approach, and look at, where the greatest suffering is. And again, radical common sense, Jesse James, where do you go to find money? You rob a bank. Same kind of thing. In healthcare, we need to go to where the problems are. And I think we need a problem-based approach as opposed to a solutions orientation, which starts with a solution and then looks for a problem. And again, I just think, even the organizations that say that they're doing this at scale, they aren't really, is kind of my view of it.
Yeah. So do you take on that approach with CareMore and try to take a problem-specific approach, and how does that look in practice? We
do. I mean, it's the transportation example is a good one. The dental example is a good one. When we started doing virtual care, we started with what's the most important thing in a caring relationship. Well, it's not the mode of delivery; it's actually the relationship. And so the question then becomes, how do we preserve and package that relationship through multiple channels, as opposed to how do we do virtual care? And so that's, again, how we think about it.
Okay. How do you go about quantifying success then? Because
Very simple. It's admissions per 1,000, bed days per 1,000. So, these are insurance metrics, but the reality is they're care delivery metrics. And from our perspective, every day that a patient spends in the hospital is bad for the patient and bad for the payer. So if you're able to kind of align on that, then we can get to a place where we really have a view that having patients in the hospital is a bad thing. And so that's the metric we look at every single day. And then we look at other things like amputation rates. We look at things like the percentage of our patients on kidney dialysis, much of which could have been avoided or delayed. So it's those types of patient-centered metrics, as well as kind of a few metrics that are patient-centered, as well as kind of aligned fully with finances, that I think make a model like ours really work.
Okay, good. You're the first one that didn't say finance business side first, which is so surprising to me. I've asked that question a number of times and heard it answered at conferences. And
I mean, if you'll let me digress about that, I think that's the power of a physician-founded organization. Dr. Shelley Zinberg was our founder, and his spirit, and then that sort of persistence of kind of a strong voice for physicians in the company, I think changes the game. I think too many folks in our industry view physicians as the problem and not the solutions. And the truth is that we know a lot about what's wrong because we live it. We see our patients live through it every day. We're not just seeing small slivers of it. We oftentimes see the end-to-end experience of our patients. And so I think we're uniquely capable in terms of solving it, provided we have the right management skill sets and the right teams to kind of balance this out. And I think that that's one of the trends that we should be looking for, physician-founded, physician-led healthcare organizations that can really bring that more authentic perspective on what's actually happening.
Yeah, and the biggest takeaway I've had from the conference is how you can't just be single-threaded anymore. I can't be an IT professional. I have to be IT plus healthcare plus.
You gotta be a kind of a triple threat or a quadruple threat.
Yeah. And it grows as the longer we go.
Absolutely.
So you started as a physician, right? Do you still hold that perspective as kind of your core, and then have added the other ones?
You bet. I mean, I was a government major in college, did my MBA and my MD kind of contemporaneously, and then trained as an internist. Also worked in policy, worked in the Obama administration for a couple of years, and both the implementation of the HITECH Act and the ACA. Was on the founding team at CMMI, led digital health at Merck, but was also a physician at the VA during that time. And now I've been at CareMore for the last 4.5-5 years now in January, and it's been a tremendously exciting ride, and I think it's all those different perspectives that actually help shape what I think I do every day.
Sure. Did you actively search out those opportunities, or did they find you? How did you have such a unique career path that it just adds some
Thanks.
context.
Yeah, I mean, some of it, yes, I sought out. Some of it just found me. Some of it was taking a risk and rolling the dice. So it's a kind of a mix of happenstance and chasing things that kind of got me to where I am. And what I'll tell you is tons of failure along the way. I mean, one of the things I hate about our industry is you kind of like read bios, and they read like, first he did this, then he did that. A lot of how I ended up where I am was happenstance, coincidence, luck, friends, and I think that's what it takes to kind of have a fun career, and I'm lucky to have all of that.
Did you try to read the market or read where things are going? You just kind of took it as it come, and whatever the next opportunity that excited you, that kind of found you?
Yeah, I'm a problem-based person, so I'm very interested in kind of the magnitude and sophistication of the problems we're solving. And for me, like solving big problems is what it's all about. So when I was at Merck, it was like, okay, how do we use digital health tools and technology, real-world data to enhance drug development and delivery of drugs to patients? Huge problem, interesting problem. Still lots of work to be done there. But then this question that CareMore has really tried to answer at scale, which is how do you care for frail and vulnerable populations in Medicare, Medicaid, now commercial as well, I think is like just stupendously interesting and relevant for our country. And I fall in love with this company at least once a week in terms of just the impact that we make on the patients that we serve, the inspiration we're able to provide to the industry, the new problems we're able to solve. We've done some industry-leading work on addressing loneliness. Again, now there's tons of copycats, I don't want to name them, who've taken both the problem that we've identified as well as kind of some of the solutions we've identified, and there's now a whole ecosystem of companies around loneliness. That was invented at CareMore. And so I think, these are the kinds of things that I think really make for, the fun that I'm having and the impact that we're able to have.
Yeah, it makes tons of sense. I'm trying to figure out for my own career how to make that work and what's coming next. So I'm always curious.
Pick a problem, Brian.
Yeah,
pick a problem, go after it for a few years.
I'm always curious when I talk to the people that bounce around, just kind of how that played out. So thinking about all the different touch points you've had, are there more similarities than differences, or are there any kind of at a high level things that stand out between the different stops you've had?
People are people. What I can tell you is where I think there's variations in behavior is in how close people are to the patients that they're serving. And I think it's very easy to get detached and, again, lose your common sense when you sit, 20,000 feet or 20,000 miles from the patient. Much harder to do that when you're sitting 5 or 10 feet away from patients. And I think that's a big part of our obligation as an industry.
As a leader, how do you stay connected to what's actually happening on the ground floor?
I still see patients. Interact with our patients quite a bit outside of even seeing them as my patients. A lot of what we do is actually engage with our patients outside of the clinical setting, because the clinical setting isn't necessarily a place where you can actually actively solicit feedback. So again, we have lunches with our members, really trying to understand what they're experiencing, what works for them, what doesn't work for them. And again, it's very humbling because you learn very quickly what you're doing that works. And then you also learn about what you think works that doesn't work. So
they're pretty brutally honest. Yeah. So what's been your relationship with technology? Because I'm guessing when you started as a physician, maybe you had an interest, but I know, at least I think I know that technology is not a huge part of what a physician does to learn to practice, right?
Yeah, I mean, I was at the Office of the National Coordinator for Health IT from 2009 to 2010. What I'll tell you is that I think technology can be tremendously impactful in terms of transforming care delivery, but it's not in the way that most people think it is. A lot of what you do as a physician is you manage and organize information, and you make judgments based on that information. So tools and technologies that simplify that and that nudge you in the right direction because of the large complexity of information that you're computing, that stuff's really interesting and very powerful. I think a lot of the solutions that people think about don't really fit into that category, right? And I think there are misses because we have this imagination around patient engagement and technology. And all I'll say is, I don't want to pick on any particular brand, but pick your favorite smartwatch. Your average smartwatch gets used for about 2 weeks, and then people get tired of charging it, and it sits on a shelf somewhere. For most people, that is I heard Robbie Pearl speaking earlier today. He was picking on smartwatches as well. He's like, look, it's a perfect Christmas or birthday present. It shows someone you care enough to spend $150 to $200 for them on them, but there's no evidence that it's actually used for anything other than to tell you how well you slept. And by the way, you probably know how well you slept. So this quantified self piece, I think, oftentimes misses the mark because it doesn't really focus on what it needs to focus on.
I've had the experience where I've woken up and I feel great, and then I look at my stats and they're like, you slept terrible. I'm like, wait, what? So you've voiced some skepticism about entrepreneurs and some technology. You're not averse to technology, though, right?
No. I think that needs to be used to enforce the purposes of care delivery. Meaning, if it is used to strengthen, so I think there are some tenets that are hallmarks of what good care looks like. Relationships are at the center. Trust. Asynchronous communication around a variety of health issues and topics. If technology enables those things, I'm all in. But oftentimes the technology becomes the main course instead of the tasty side dish or the dish itself, the enabler, right? That's where we run afoul.
Okay. So do you actively look to partner, or are you always on the lookout for the latest and greatest, or do you kind of let things bubble up to the top?
Yeah, so nobody should contact me, but we have a VP of digital solutions, a guy named Omid Taloui, whose job it is to screen solutions and look for the ways where we can really actively improve the patient experience and hopefully reduce costs. Those are the two objectives we have of integrating technology. And because we have those objectives, we've built remote patient monitoring solutions that integrate digital video. We've actually integrated a new solution around virtual translator services using mobile iPads on rolling stands. Not terribly sexy stuff, but if you're somebody who doesn't speak English as your first language, having real awesome virtual translation services available at the point of care is a complete game changer for you, in multiple languages, in all the languages that you could potentially want to see your patients in. That's huge, right? So that's something that Omid did, very early in his time with us. That's, I think, paying huge dividends for the organization.
It seems like a lot of the entrepreneurs and startups that I've come across, they have the technology or the product, and they're trying to figure out how to integrate. Do you think that's the model, how this plays out, and how things really change is the partnerships between organizations like yours and startups?
I referenced it earlier. There's a narcissism of entrepreneurship, and I don't mean that in a negative way. It's just the reality of, if you're devoting your whole life to this one thing, you just believe that one thing is the most important thing. I recently had a conversation with a buddy of mine, my college roommate actually, and he was telling me that I sounded jaded because I was not that interested in hearing about his friend's, new IT solution to help identify whether people were lonely, based on their smartphones. And I'm like, look, I could just ask the patients if they're lonely. He's like, well, isn't it interesting for you to find the people who do? I said, yes, but let's just start doing some useful things for people who have already identified themselves as lonely. Let's do the common sense stuff. And again, the entrepreneurs, they become enamored of their solutions and their technologies, and they're great. And all of this development work will pay off one day. But I think they oftentimes overclub the sophistication of the current healthcare system, which is pretty unsophisticated. And we have basic problems like, how do we effectively schedule patients? How do we effectively remind patients to come for their appointments? Totally boring, interesting stuff. But those are the companies that get me most excited. So we just, we're doing a big partnership now with a company that Arun Mohan launched called Radix Health. What they do is pretty basic. They use machine learning algorithms to identify which patients are at high risk of not coming, which allows us to more efficiently book patients, double book patients, remind patients. Again, boring stuff. But the most precious resource in my healthcare delivery system is clinician time. And that clinician time, if it gets wasted, is a patient not being seen who should be seen. So it's that type of stuff that I think makes a big difference.
So let's talk about clinicians for a sec, because how would you articulate where clinicians are at now in today's age? Because there's been a lot of talk about there's information overload, they can't keep up on everything they need to. Working with the technology is the challenge. So I guess what's your take on?
Well, the first observation I'll make is that we're both calling them clinicians, not providers. I think that's really important. I think one of the biggest problems we have in our industry is we've started to commoditize care, and we need to kind of re-energize people around the compassion, the humanity, the humility. Many of us went to healthcare to help people, and then the day-to-day lived experience of that doesn't feel like that. And I think our job as an industry is to close the gap between the aspiration people had when they started and the actual lived experience of who they are, what they do, and how they do it.
Yeah, that's really simply and articulately put. We overcomplicate it quite often. So what would you say the future looks like for CareMore or something like some? Hold on one second.
We've got a train out here.
Yeah.
It's quite an outstanding train. It's the healthcare train. It's the CareMore train. It's getting bigger and stronger every day.
Now back to your regular scheduled program.
So we need to see more patients, and we need to be better at seeing them. We need to continue to innovate. We've always focused on keeping patients out of the hospital. We've never had a hospital at home program. We're quietly, I guess now that I'm telling you about it here, it's not so quietly anymore, but we're quietly running one of the largest hospital at home programs in the country. So far in the last year, we took care of over 400 patients who otherwise likely would have been admitted to the hospital in a home-based setting. It's these types of things that are going to push the envelope, change the game, inspire an industry, and really kind of, move the needle. And we want to do it in more places and at greater scale with higher fidelity. The sort of most important thing to doing what we do is actually getting the right people to do it. One of the biggest mistakes people make is as they start to scale companies is they start hiring warm bodies to do work where you need engaged professionals. You would never send your mom to, a warm body. You would want her to see somebody who actually gives a damn, right?
You can cuss.
Gives a shit. Sorry. And so I just had to say it. But so much of how we think about hiring people and engaging people is can they do the job? Let's check the boxes. Somewhere where we spend a lot of effort at CareMore and Aspire is look, we're trying to be the best healthcare delivery organizations in the country. We need to have the best people working for us, period, full stop. And, so a big objective for us in, the year 2020 is to really be the best healthcare workplace in America. And we've thought a lot about what it means to be the best healthcare workplace in America. It doesn't mean that you have jars of Skittles sitting in the break room, although I like Skittles, I like Fun Dip, like Spree. Those are my candies of choice, the listening audience. However, on the flip side, what I think makes people really passionate about their workplace is if they find meaning in their work, if they find meaning in the delivery of care. So I think our work going forward is really going to be about making sure that we're instilling that sense of meaning and purpose and values for the people who serve our patients. We can't have a nation of burnt out clinicians. We can't have a nation of people who don't love the work that they're doing. That's a big risk for us right now, and that's unfortunately a little bit of where we are.
That's a great lead into my final question, because I would say my takeaway from coming to the conference is that healthcare is changing. It's just there's no ifs, ands, or buts about it. Being a part of that to me is incredibly exciting and gets me eager for the future. I'm guessing you share those same thoughts. Just put some words around being a part of the evolution that's happening and why that gets you excited and gets you out of bed.
Yeah, we need less evolution and we need more revolution. That's where I am right now. There's too much incrementalism that's celebrated. I believe that we can't celebrate like just doing the right thing. We have to celebrate the people who do the right thing, but like organizations that just kind of deliver on stuff that they should be delivering on, that should be like run the business stuff. And what we need more of right now is kind of putting the patient back at the center. We need to also put the people who deliver care back at the center with them. And then we need to enable them. That's the work that needs to be done. And what I struggle with is how much of what we're doing feels tangential to those two things. And so I'm optimistic because I think there are people who are doing the right things, saying the right things, executing on the right things. But what I'd like to see from this community going forward is more radical common sense, less hype, more confidence that when I need the healthcare that's going to be delivered, or when my parents need it, it's going to go well. And I think the truth is that many of us don't have that confidence today. We have a system that's built on bubble gum and duct tape and Elmer's glue, and we got to get away from that. We got to get to clear, cleanly engineered, designed delivery systems that actually make a difference.
That's a great point to end on. I know you do a lot of online content, so where do you point people? Do you want LinkedIn, Twitter? Where's the best place? Because I definitely would recommend everyone to follow Sachin because he posts some great content.
No, thank you. Any one of those places, I usually kind of, it's usually more or less the same, but appreciate all the support and look forward to working with you more and working with the broader community more to try to do the right things.
Absolutely, yeah, and thanks for all the content you put out because it definitely provides a perspective to me that I don't get in my day-to-day job, so I find it hugely valuable.
Awesome.
All right, well, thanks. We'll be back with another great guest, and thank you for your time, Sachin,
Terrific.
and best of luck with the rest of the conference.
Thanks a lot, Brian. Appreciate it.